Hi, this is John Adamson, the Rehab Documentation Guru. Let me get these glasses off. They always show my blue light blocker in the lens. Anyway, coming to you on the morning of, what is it, May 22nd, 2018. I'm going to talk to the speech therapists out there, about medically unlikely edits. And basically what this means is when you apply two CPT codes together, Medicare looks at it and says, I don't think those should be billed together. And the main codes I'm going to talk about today are 92507, which is your treatment of speech and language, and G0515, which is Medicare's what's called HCPC. It's a billing code for cognitive retraining. Medicare doesn't expect to see those codes generally together. And in fact, even though you might not bill them on the same day, it will set you up for a little bit closer scrutiny of your claim if you have both those codes on the same patient. Here's the thinking behind that. Medicare expects that speech language treatment will include some cognitive related items. So you might have some goals that are related to cognition still using 92507. Number two, Medicare expects speech language pathologists to primarily treat speech and language, not necessarily cognition, even though you obviously do as a speech language pathologist. And then lastly, G0515, which is the treatment of cognitive retraining. That is specifically geared towards patients with more of an acute or subacute recovery phase from things like traumatic brain injury or CVA. They do not expect that code to be applied to patients who have chronic, progressive cognitive dysfunction disorders, such as Alzheimer's or Parkinson's related dementia, because the code G0515 is meant to restore function, and what Medicare will say is that these patients are not restorable. So if you have diagnostic codes for chronic progressive cognitive dysfunctions, G0515 is an unlikely billing code according to Medicare. So keep those things in mind, and that'll help you in preventing some claim denials. Because if you have the right coding for the right patients and you're not overlapping both those codes on the same patient, you'll be less likely to face an audit of that chart, which is always a good thing. Anyway, this is John Adamson, the Rehab Documentation Guru. Hope you have a great day. Talk to you later.